regards to community health insurance scheme, it's one of the, I've said, is the best model I have seen to address the issue of healthcare in Kwara State in Nigeria, and I think same model will work for Africa. It's a great day. If you see the turnout of people today, the joy and the expression, because it now makes it possible for them to be able to have primary health care.
The governor of Kwara, Mr. Saraki, is the chairman of all the governors of Nigeria. And he, in October last year, introduced me to his colleagues and said, this is the future for Nigeria. And he said, and if it's not the future of Nigeria, at any rate, it's the future of my state.
You talk about malaria, you talk about HIV, you talk about tuberculosis, you talk about polio, you talk about all these areas that can be prevented, addressed if you have good primary health care. And this scheme enables people to be able to afford primary health care. And I believe that this is what our focus has been. Our focus has been on primary health care. You've got a local private partner and you've got a foreign private partner, where what we as government do, we rehabilitate the hospitals as our contribution. The funds are managed by the insurance company and the local company. So the private company go ahead and manage the actual enrollment, the scheme, and that is why it's also why it's been successful.
The state, so the governor here present, is going to take over the program once we have finished a 5-year period. And that is a breakthrough of major importance.
When we started, one of the clinics we started, nice clinic, but every month we only had 19 cases of people turning up because they just couldn't afford it. When we started the scheme, now we have every month 2,500 visits per month. It clearly shows that affordability and access makes people use Medicare.